Good evening, everybody. I'm Rajvi here, the convener. So good evening. This is Rajvi here from the Indian Fertility Society Special Interest Group on Holistic Health. And I thank you all for joining in on this online webinar, online symposium on this very important topic of polycystic ovarian syndrome and managing it with an holistic approach. So a very small brief before we start our program. The Indian Fertility Society has more than 4,000 members, and I'll have the secretary, Dr. Surveen, talk about the Indian Fertility Society. But our special interest group is primarily looking at the couple and the doctors who are treating the couples with infertility or with fertility issues. And our focus is not just trying to overcome or bypass the disorder, but to ensure that we provide holistic care to the patient and increase the awareness of the lifestyle modifications which can improve fertility. So this is the second webinar that we are having in the series. We had an earlier one on yoga, and this is more focused on polycystic ovarian syndrome, which has to some extent reached pandemic proportions. So in the 1990s, we barely saw cases of PCOS. Today, every young girl is aware of PCOS. So to show our possibilities of how one can handle it, today's program, we will have Dr. Surveen start the program. Then we'll have Dr. Shalini, who will be talking about the myths, as this program is open to public and increased awareness. Then we have a celebrated and a very well-known nutritionist, Ms. Rujuta Divekar, who will be giving us tips on dietary aspects. I'll be talking on yoga. And then we'll have Dr. Ritu Jain, who will talk about the lifestyle modifications which can help patients with PCOS. And we have our mentor, Dr. Papa, who is here. And thank you, Dr. Papa Dasari, who is our guide and mentor for our SIG, who will give us our concluding remarks. So with this, I will now just introduce Dr. Surveen. Dr. Surveen, actually in the Indian Fertility Society, nobody really needs an introduction to her. She is one of the very experienced ART specialists, I would say, in the country. She is currently the Senior Director and Head of IVF and Reproductive Medicine in the Max Group of Multispeciality Hospitals in Gurgaon, Professor in the School of Health Sciences in Ansal University with 32 years of experience. We always know her as a very articulate speaker who is very, very scientific in her approach, which is reflected in her having over 80 publications in journals and books. I'm not going to take much time as Dr. Surveen herself will speak about her credentials. So thank you, Dr. Surveen. I know how busy it has been post-Diwali. So thank you for giving us the welcome address. So over to you, Dr. Surveen.
So thank you, Rajvi. I think this, as all your initiatives, this is a great one. PCOS is the need of the hour. And I think all of you, Ritu, Shalini, Dr. Papa, her guidance, I think it's one of the subjects that is really, really needed. And what you are going to do today is what is generally not touched upon in a usual conference. We'll talk about things like metformin and we'll talk about things like clomiphene. But what actually makes a difference is the lifestyle. And I think you've got a very good speaker with you. On she is really good with her dietary advice. And as far as Indian Fertility Society is concerned, we are spread across India with 29 chapters. And I hope you're going to take this pan-India to various chapters and make sure that it reaches, even the smaller towns, because it's a brilliant topic you have touched. Thank you so much and all the best.
Thank you, Dr. Surveen. And I really hope that we are able to reach out all over the country and bring this holistic approach through our doctors to the patients who really need it the most, as time will say. So without much ado, I would like to invite the first speaker, my co-convener, Dr. Shalini Chawla. Again, a very experienced person, Dr. Shalini Chawla Khanna. She is an MBBS, a DGO, DNB, and an MNAMS. She's a senior IVF and laparoscopic consultant, again with Max Hospitals in Delhi and NCR. And she is the executive member of IFS since 2020 and editorial board of the Journal of Case Reports and Images and OBGY. She's a course coordinator. Academics is her forte again. Many awards, and primarily a laparoscopic and a hysteroscopic surgeon with special interest in poor responders and recurrent implantation failure. So all it says that she doesn't just look at the successes, she looks at all the difficult cases, the poor responders and recurrent implantation failures. Great stress factors for those working in the ART, because failures, we as ART, working in the field of ART, see more failures. We consistently see failures, and that is a lot of stress for us.
Yeah.
So over to you, Dr. Shalini.
Thank you so much, Dr. Rajvi, for such kind words. And it's a pleasure to work with you. You and Dr. Papadesri has chosen a wonderful topic. And let's hope I'm able to do and cover up and solve some myths about the PCOS. So I'm just sharing my screen. Is my screen visible?
Yes.
Okay, I'll just do the slide share. Okay, so I just would be talking about the myths and facts about the PCOS. Now, since I'm the opening batsman and we are live on YouTube for the visitors and the other people who are not in the medical fraternity, would just like to give an idea about the PCOS. So PCOS it's the most common endocrinopathy of the reproductive age women with a prevalence of 8 to 20%. And the typical clinical features involves hirsutism, which means excessive hair growth, maybe on the face, on the chip, on the chin, on the lips, or maybe on the breast or on the navel. The cycles could be irregular. Usually the cycles in polycystic ovary patients, they are delayed, and they are delayed as long as 2 months, 3 months, or at times the patients have to take medicines to get the periods or induced periods. That is chronic anovulation, means that she's not forming an egg, and once she's not forming an egg, she's anovulating, the progesterone hormone is deficient, and that at times further leads to irregular periods and delayed cycles. And then many of the patients, they can present with infertility. Now, PCOS diagnosis, it differs in adolescents and in adults. In adults, we take this as the Rotterdam criteria, where 2 of the 3 factors have to be positive. Oligo or anovulation, as I described, that she doesn't ovulate and she gets very scanty periods, maybe at delayed interval of time. Then clinical or biochemical hyperandrogenism, where there are acne, hirsutism. Hirsutism is excessive hair growth on the face, or as I described earlier, acne, or maybe acanthosis nigricans, and the polycystic ovaries on ultrasound, and after exclusion of related disorders. So if 2 out of these 3 factors are positive, we take these patients as polycystic ovarian syndrome. However, where so we just need 2. Now, if both oligo anovulation just by the clinical history, which suggests delayed cycles, and hyperandrogenism like acne and hirsutism, if they are present, then ultrasound is not necessary for diagnosis. So this becomes my first myth. Many patients come with us that and they tell us that they need ultrasound to diagnose PCOS. So because the lack of time and short 15 minutes, so I have just added few myths in just as a positive points only. So we don't need an ultrasound. Now, adolescent diagnosis is different from the adult, where we need oligoanovulation and hyperandrogenism, and ultrasound is not recommended, because in young patients, the number of eggs are much more, and they can be confounding factor, and they can mislead us and overdiagnose the PCOS. And I guess Dr. Ritu will touch much more in this detail. So this, I think Dr. Ritu will touch. Now, the another myth is that patients, when they come to us in the OPD, they really feel, and they really are at so much of guilt, and they say that, have I done something wrong to cause PCOS? Now, it is important to make them understand that entirely the patients are not to be blamed. PCOS is inheritable in 70% of the cases. Women whose mother and sisters, they have PCOS, and they are more likely to be affected by this condition. Now, PCOS, there is an interplay of neuroendocrine, hormonal, metabolic, genetic, and environmental factors. And by the time the diagnosis is established, PCOS is just the physical appearance or it's the outcome of so many interplay of factors which are playing inside our body. And it is right from the in utero, when the baby is in the mother's womb, the process starts right itself there. And again, the insulin resistance plays a very important factor. Thus, the current definitions, however, there is another myth which we need to sort it out, that though insulin resistance plays a very important role in the pathogenesis of PCOS, but the current definitions, recommendations, or guidelines, they do not include the testing for the hyperinsulinism. Like many of us, in fact, we do write blood sugar fasting, blood sugar PP, and serum insulin fasting, and serum insulin PP. So that's again a myth to be busted, that insulin testing is not routinely recommended. So this is just a comprehensive view of the etiopathogenesis of the PCOS. I've just put it down just to make an extra conscientious effort so that the patients, they don't take it all that to themselves. Now the process starts in utero itself. There is a CNS programming. Along with that, there are epigenetic and genetic factors. When a girl reaches puberty or adolescent, the exercise, activity, environmental exposures, hormonal exposures, all they play an important role in the pathogenesis. So just to conclude that it is an interplay, and yes, definitely it is a modified condition. So the patient's role or somebody's role comes there only where they can modify, but they cannot control the inheritable genetic factors. So another myth, that PCOS, it affects only the overweight women. Now it's again a myth. Though majority of the patients who are PCOS, obesity is linked to it, and they just go hand in hand. 38 to 88% of the PCOS women, they are either overweight or obese. However, now this needs to be busted again, that up to 30% of the women with PCOS, they are thin and lean. And even in thin, lean patients, the prevalence of insulin resistance is 6 to 20%. This thin, lean PCOS, because they think that they are thin, maybe there's so much of Google knowledge prevalent these days, and it spreads from mouth to mouth. So people feel that they are thin, they are not obese, so they are not PCOS. And thus it can go unnoticed for years and years. Now these overweight and obese women, because they are overweight, because they are not able to lose weight, it can be diagnosed in the high school. Whereas the thin, lean women PCOS patient, they may not be diagnosed until they reach the marriageable age and until they find it difficult to conceive. So even the insulin resistance is very high in PCOS patients, as I have already highlighted earlier. However, 3 to 10% of the thin, lean patients, they also have insulin resistance, and they also have undiagnosed diabetes. Now, because they also have increased level of androgens, they can also lead to symptoms like acne, unwanted hair growth, and hair loss. So all these symptoms, they do occur in thin, lean PCOS patients also. So another important factor, where we say that if you are thin, but is it necessary that you are PCOS or not? Then there comes an important role of waist-hip ratio. We measure the waist ratio at the thinnest point of the waist, and then hip measurement at the maximum point of the hip. We calculate the waist-hip ratio. So women are more likely to have insulin resistant and PCO if their waist-hip ratio, especially in the Asian ethnic region, is higher than 0.85. Now, another myth, that you cannot get pregnant if you have PCOS. Agreed that PCOS women do find it difficult to conceive. because in PCOS, the ovulation does not take place. She does not form egg, and it represents 80% of the cause in anovulatory infertility cases. However, it is not 100% correct. Many women, they still ovulate intermittently. Many women, they do have regular cycles despite PCOS, especially as I highlighted in the thin lane PCOS. And with the treatment, the first line, see, for all the medical management, the management or the comprehensive management of PCOS, lifestyle management is just the key factor. We lay so much. In fact, all the doctor fraternity who are there with me, they will agree with me that we all counsel our patients to have a healthy lifestyle. So if the healthy lifestyle, which involves, which I'll further discuss it, if the healthy lifestyle, if this still she doesn't conceive, there are fertility drugs. These are the ovulation induction drugs like clomiphene, gonadotrophins, which are effective, and with those they can, even 70% of people can conceive. The next comes, if the patient is being undertaken for laparoscopy for any other purpose, ovarian drilling can be done and effective in 50%. And if not, then IVF is certainly is the answer. So, these people are, even I see a lot of young girls coming to me at the age of 23, 24, that they have PCOS and they have anxiety that they will not conceive. So we need to counsel them and we need to tell them that they can conceive with simple medication and with the lifestyle modification. So, this panel has come up. I can't read that question. Okay. So it's a myth that PCOS can be cured by medicines and birth control pill. Now you must understand that the etiopathogenesis of polycystic ovary is such that, it doesn't go away. The presence of the ovary, the presence of the follicles in the ovaries, it doesn't go away. It stays. However, you can modify and prevent the long-term hazards by the healthy lifestyle like diet, physical activity, and even losing 7% of weight, you can conceive a spontaneous pregnancy. Just 1 minute, my slide is not moving. Yeah. And, this treatment, I have said, Dr. Ritu obviously would be considering all this, but this was just a myth that you cannot cure it, but we can modify it. And in the young adolescence periods, if we are giving the birth control pills, which work, then the duration of these pills, they are to be taken for 24 months in adolescence. And however, these birth control pills, they work wonderfully, and they can be taken for years and years, especially in married women who are keen for conception also. But those young adolescents women who are not keen for conception, and they can be managed with the progesterone, which are just given for 10 days. And just why this treatment is essential, because by losing weight, this overweight and obese women, they can help balance their hormonal levels, and lifestyle interventions highlighted again and again that they play a very important role. And just to this thing myth, bust another myth. Even till now, when I read the literature, in many of my patients, I would give the ethinyl estradiol and cyproterone acetate. However, that was an eye-opener that this kind of combination pill is not the first choice because it increases the risk of venous thrombolism. So just simple birth control pills like Novolon, Femilon works good enough for you. Now, another myth that if you have another myth that if you're not looking to get pregnant, you don't have to worry about PCOS. No, certainly this is not the fact. The fact is that PCOS does have a long-term complications, and that is why the lifestyle modification is just the key factor, which needs to start as early as in the adolescent, because it can cause diabetes, high blood pressure, cholesterol, sleep apnea, depression, anxiety later on in the life. So it's a myth that if you don't want to get pregnant, you don't need to do anything. Certainly, you need to have a healthy lifestyle if you want to if you want to be healthy and have a good, healthy future. So now this is a diagnostic test. Now, can AMH levels be used as a diagnostic test? I mean, majority of it, it's a myth that just by some people are not keen for ultrasound and they say that they just want AMH to be done. So, however, the AMH, it's a myth that AMH is just a supplementary tool. It's not a complementary. Alone, it cannot suffice the diagnosis of the polycystic ovarian syndrome. These young girls, they read it so much on net and they come with the AMH reports on their own. So now what is AMH level? Just for everyone's information, AMH, it reflects the ovarian reserve. That means it just shows the number of eggs that each woman has. And till now, it has not been proven that AMH can be used as a surrogate marker to diagnose PCOS. AMH, however, AMH concentrations, they are elevated in obese and PCOS girls. No cutoff level has been defined till now. Again, very important, majority of the patients, they come and they are already taking metformin. So is metformin, it's a myth, again a myth that metformin is essential. Now, to burst this myth, I always tell my patients metformin is always equivalent to the lifestyle modification, and metformin certainly has a role. I'm not saying that, but it certainly has a role in few conditions where the BMI is more than more, or where there are metabolic disturbances, or the patient is at increased risk of type 2 diabetes. Maybe there is a history of diabetes in the parents, either both the parents are diabetic, she's not losing weight, BMI more than 25, then in certain cases, metformin is certainly required. And but for the hirsutism, the metformin does not play much role. Again, that the irregular cycles, it means all the irregular cycles in a young adolescent, does it mean PCOS? No, because all these irregular cycles, it's again a myth. PCOS certainly is a cause of irregular cycles, but there are certain other causes which can lead to irregular cycles like thyroid dysfunction, hyperprolactinemia, Cushing syndrome. So women, just with the Google sharing knowledge, they should not be sitting at home if they have irregular cycles and they just read it on net that they have PCOS. The other causes need to be ruled out and they need to see the physician. Now, again, it's a last myth which I'm talking about. Though Ruchita and doctor would be talking about it. So just in one word, that probiotics improve PCOS. Now, what are probiotics? Probiotics, these are like the Bifilic and all that, because why they have a being suspected role in PCOS? Because in a normal gut microbiome is like the gut microbiota is consists of bacteria, fungi, viruses. They influence the metabolism of the one's human body. And sex steroids, like the PCOS, there is an interplay of sex hormones and sex steroids. And decreased alpha diversity, which means the number of species. The number of species means the number of types of bacteria, the fungi, and the virus, they are less in PCOS. So, however, it's still in the experimental phase and many questions needs to be answered. Maybe we get the answer from Rujita and she solves this myth for all of us. And with this, I guess I end my presentation and rest I have left. Hope Ruchita will be solving so many myths about PCOS. Thank you so much.
Thank you, Dr. Shalini, for clearing out all the myths about PCOS. Today, like we just said earlier, irregular periods, hirsutism, acne, all this becomes a big issue for young girls, and it is very stressful. And people, Google doctor often is little dangerous because people self-diagnose and that adds on to a lot of stress. So there is one question for you, so we can take it before we move on. The question is, if a patient is not able to lose weight with lifestyle intervention and is on drospirenone and EE, what can we do to control obesity?
I think Ruchita will answer this question certainly. this question
Okay.
further, Rajita. And
So,
she certainly is going to guide us about the diet modifications and all. So we can discuss this again after a while once
okay.
Rajita takes over.
So,
Because
Archana,
this, aggressive, I mean, just whatever I just can comment like this, that losing weight is certainly not easy. It certainly requires lot of efforts, and there are certain, I mean, apart from the diet modifications, the exercise, 150 minutes of exercise is recommended. If it is a moderate intensity exercise, or if it is like severe intense exercise, like powerful exercises, aerobics and all, then 75 minutes of vigorous exercise is required. So, a constant effort has to be there, and over months and months. It's not that easy. I totally agree to lose weight, but then don't lose heart. Keep trying and keep working hard and do a lot of physical exercise. And with good diet control, I think you can control your weight.
okay. So, Dr. Archana, who asked the question, the fact is that even as a professional obstetrician and gynecologist, Dr. Shalini says that lifestyle intervention still remains the mode
Yes.
of choice for losing weight, and she's not moving in the realms of medical therapy. So with this, thank you, Dr. Shalini. So we now move to our next speaker. And well, Rujita Divekar, and honestly, she doesn't need any introduction. But as a convention, I would like to inform our speakers, yes, she is a very, very renowned nutritionist. She is very well known for her books, and she has literally millions of followers. But these followers have not just come by marketing or advertising gimmicks. Rujita makes it a point that whatever her talks are, she is not going to sell anything. And she has a lot of academic qualifications behind her. So I would like Shivam to just share the screen just for people to know Rujita not as just a celebrity nutritionist, but also her other work. So Shivam, can you please share the screen? Yeah, so yes, Rujita Divekar, very well known for all her work with the stars, but do know that she has 90 million views, and it is not that anybody and everybody you can consistently get people to view you unless you're giving them something new, something effective. So you may sell anything, but if you are not giving a product or advice which is effective, you cannot survive. So that itself says it. She has done her education, starting with her basic education with SNDT College, Mumbai. And then she has moved on and studied in all parts of the world, Australia, Germany. And I know that she's an ardent practitioner of yoga, which is as close to her heart, if I may say so. And she is doing a lot of welfare projects with the Mumbai police. I'm aware of that, regularly advising them in their extremely stressful lives. Fitness project. She has a farm where she gets people to respect the food that they eat. I'm not going to take away her time. So Rujita, some starting words before we move on to the dialogue that we intend with you.
Okay, first of all, I want to say that I'm really happy to be joining all of you. And, I did listen a little bit to what Dr. Shalini was saying. And this is a very, very important topic. And like you rightly pointed out, Rajvi ma'am, because she's also my yoga teacher and, an inspiration for, why I do yoga. And a lot of my yoga videos, not a lot, all of my yoga videos come from the school of Iyengar yogas. And PCOS is growing, and anytime that any kind of a condition grows, the confusion around it grows. Interestingly, the solutions around it, the confirmed solutions around it grow. And what we often see in the industry of weight loss and fitness is that people's confusion and fear gets monetized, and they can just go the wrong way. So I'm really glad that you are reaching out to people in a very authentic manner and trying to help them with what they see in their bodies and what are the strategies that they can take long term to change it. Because a lot of times people just think that PCOD is about mere ko aage jaake bachcha nahi hoega, but that's hardly the problem. The problem is that day to day, month to month, you could be living a life which is suboptimal. And I think that is really something that needs to get addressed, that every woman should deserves a life of joy, fun, and freedom. And it starts with good health. It starts with good hormonal health.
So thank you for the starting remarks. Yes, the whole idea of our special interest group is to have a good interaction, get clarity for the patients. And as you say, it is growing. And there's so much of information overload that one doesn't really know where one is heading. So Dr. Shalini very clearly said that, yes, the common conception is that, PCOS is associated with obesity. The fact is that nearly 20 to 25% are lean, and that is lean PCOS. But then with the patients who are obese, and the first thing, like Dr. Shalini said, you'll say go in for lifestyle modification, reduce weight, and come back. Now the patient is in a full state of, I would say, very distressed, because they feel that they have gained weight because of the endocrine and the metabolic disorder PCOS, and there the doctor says lose weight and everything will be okay. So it is like a chicken and egg story.
Right.
So what would you advise the patients who come in, so that they don't lose their mind? Because what is the cause and what is the result?
Yeah. What I often say to everyone that I work with, because invariably when you go to a doctor, whether you went to a heart specialist, whether you went to a skin specialist, whether you went to an endo, whether you went to a gynecologist, whether you simply went to an orthopedic, one of the advices that you get, and you get like bang on within the first few minutes of reaching the clinic, is lose weight and you're going to be fine. Or I'm giving you 3 months to lose weight, or nahi lose karegi, so I'm going to put you on pills. And I don't think that that's a very empowering statement to start off with. They're any which ways confused, conflicted, fearful, and lose weight or else only leads to them trying out all kinds of things that they should actually be staying away from, whether it is over exercising, whether it is eating too little, whether it is doing smoothies and soups, or fasting and detoxing. They try all of these things because a lot of times it's like kaisa bhi karke vazan kam karo. So I say to my clients that every time you hear the advice, just lose weight, you translate that into your head as just get fit. If you work towards getting fitter, if you work towards improving your body composition, if you actually worked towards building more stamina, strength, mobility, flexibility, then most of the problems that you are seeing do get resolved. And we do know that this is really not all about weight. As you rightly said, people are saying, about 5 years ago, I would only hear the term lean PCOS in a medical conference. Now you have patients using the term lean PCOS. So we do know that you could be well under normal BMI and still be having PCOS and PCOD issues. So it's not about losing weight. It is about leading a healthier life than what you're currently leading, and really thinking about your life in a more sustainable way, so adopting diet, exercise, and lifestyle strategies that you can live with for the next 50 years, that you would be happy if your grandchildren adopted from you. So that's the kind of food, exercise, and lifestyle strategies that we need to look at. And it doesn't matter even if you didn't lose weight at the end of it, because if you adopted something which is sustainable, sensible, and simple, which you can do on a day-to-day basis, then you will surely get healthier. And when you get healthier, everything in your body responds to that good health. We don't have one kind of a thing that you can do only for the ovaries, another kind of a thing that you can do for the brain, the third thing that you do for the knee, and the fourth thing that you do for maybe the heart. We are a whole body, whether or not we like it. So everything that leads to an overall improvement of our health leads to an improvement in the symptoms that we are seeing in any area of our life, including PCOS.
So would you go on to say that, when you adopt what tips you will be giving us later, what you refer to as a healthy lifestyle, even if they do not lose weight, they don't at least lose their mind
Yeah,
and
that's
get
the point,
into,
because you will also find doctors telling you that even stress can lead to a hormonal disorder. I mean, if you have cortisol levels which go up, which is typically called as the stress hormone. So if you have cortisol levels that go up, then you can't burn fat as effectively as you want to be burning it. And you can get much fatter than what you would like to be. But so yes, I am saying that if you adopted a few basic commonsensical lifestyle strategies, then you will be healthier and you will see a significant resolution of your symptoms.
okay. So my next question is that, today it is quite popular to go on intermittent fasting because people believe that if they don't eat, they will lose weight. And people don't eat for 14 hours, 16 hours, etc. What would you advise them? What would be your experience with this kind of extreme fasting over a period of days or months?
See, first of all, intermittent fasting, when it started, it just started as the new thing, and everything that is new in the dieting world just tries to do the old thing. And the old thing is keep people off calories, somehow try and create a calorie deficit. Now, the popular narrative is that the only way to create a calorie deficit is to do something extreme, is to do something that is punishing, is to do something that is that requires a lot of willpower. But on the other hand, what actually works in real life is if you take a more nurturing approach towards yourself, if you simply ate on time, drank water on time, went and did your exercise on time, slept on time, then you could pretty much be in a place where you're metabolically healthy, where your energy levels are better, where you're sleeping better, where your periods are regulated, where your waist to hip ratio improves. The problem with intermittent fasting is that when you don't eat for many long hours, you do land up having lesser chances of making up for all of the nutrients that your body typically needs. Now, in PCOD, PCOS, what you will also see are deficiencies of folic acid, deficiencies of B12, deficiency of hemoglobin, deficiency of actual ferritin, and deficiency of vitamin D. And doing any kind of an extreme diet, including intermittent fasting, will only go to increase those deficiencies. So we see lower levels of B12, we see lower levels of hemoglobin, and a lot of times people are like, "ठीक है, लेकिन मैं एक supplement ले लूंगी," but that supplement is not going to, resolve your problem. You need you need your lifestyle to ensure that this problem is not getting created, because you're coming from a household where there is adequate food to eat. So micronutrient deficiencies is one of the issues that we see with intermittent fasting. Loss of a period is another problem that we see, and any which ways with PCOD, PCOS, you may
Rujuta, we lost you for a moment, so can you repeat?
Okay. I was saying that nutrient deficiencies, micronutrient deficiencies, is one of the things that we often see with intermittent fasting. The other problem that we see with intermittent fasting is actual loss of period. So the people actually begin to lose their period, and with PCOD, PCOS, regularity of periods is any which ways a challenge. Now, you don't need a diet which increases chances of you skipping your regular period. So that's the other problem that we see with intermittent fasting. And the third problem that we see is in poor quality sleep. And we all know that if the sleep quality gets poor, then hormones like IGF-1 don't really function like the way they should, which means that your chances of getting insulin resistant increase, and you don't want to do any of that. So even when we are talking about weight loss, we need to understand, I want to lose weight at what cost? The healthy and the sustainable way to lose weight is to lose between 5 to 10% of your body weight per year. So if you're 100 kilos today, then we are talking about you being 90 kilos in October 2023. And if you do things which are going to make you 90 kilos in November 2022, then by the time it is October 2023, you are 120 kilos and your problems have gone up tenfold, and it happens all the time. So instead of people losing weight quickly, they have to lose weight steadily. And once you lose weight steadily, then you actually have the luxury, if I may say so, to eat the right meals without doing anything extreme, to exercise in a way that it doesn't leave you drained out, to actually function as a professional or as a person on a day-to-day basis, to sleep on time and to wake up fresh, and to enjoy a chocolate pastry because you wanted to and not because you got desperate for it. So that's really the key, that instead of quickly losing weight, we change that to steadily losing weight, 5 to 10% every year, and we are in a good place.
Okay. On the same note, because people want to reduce consumption, thinking that reducing consumption will lead to less buildup of weight. So one of the other options that people use are in the dietary sense is to go on a very low carbohydrate diet, or even low carbohydrate accompanied by a low fat diet, and just a high protein or a keto diet.
Right.
Now, physiologically, obviously, it's going to change the entire metabolism, moving it away. So what is your take on trying to break up diet into carbohydrates, proteins, and fat?
Okay. When you split your food into carbohydrate, protein, and fat, it is like splitting a girl into her height and weight and skin tone. It doesn't work. It doesn't give you the full picture. That is not the reason why you should be getting together with someone. Just because someone is this much weight and that much height and this kind of skin color, I shouldn't land with a job. I shouldn't land with a husband. I shouldn't land with a airplane seat. I shouldn't land with anything. And if I did land up with any of these things, then it is what is called as an ism. So it could be sexism, it could be racism, it could be ageism, it could be any of these isms. And looking at food from the point of view of carbohydrate, protein, and fat is nothing else but nutritionism. Now, in terms of scientific dietary guidelines, if you look at the dietary guidelines of Canada or US, or for that matter, even Brazil, then you will notice that there has been a shift from what used to be called, what is called as nutrient-based guideline, where if you went and met a professional, they would say, just eat protein-rich, avoid carbs, just eat low fat. Because when you say these kind of things, people don't understand what is it that they should be eating. So instead, the scientific guideline now, evidence-based, is to give you food-based dietary guidelines. Food-based dietary guidelines is like taking the name of the food that people should be eating. So saying things like, ghar par zyada khao, call in lesser, use your Swiggy and Zomato lesser. If you're using it every day, use it only once a week. Eat more roti, sabzi, dal, chawal, eat your badam and kishmish, eat dahi and chas, eat your bhakris, have your matris, eat fresh fruits every day. If we talk in this language, then people feel empowered. They understand what is it that they have to do. And then they stay away from choosing foods based on nutrients. In nutrition conferences, it is a like nutrition academics will often say that they split food into protein, carbohydrate, and fat to kind of help the common man make better choices about food. But all that it has done is that it has allowed the food industry to make bigger profits on food. So you have a biscuit and then you have a protein-rich biscuit. Protein-rich biscuit is 40% marked up than a normal biscuit. You have an ice cream and then you have a sugar-free ice cream. Sugar-free ice cream is more expensive. You have dairy, then you have low-fat dairy. Low-fat dairy is more expensive, and people are busy consuming and buying pricier products for better health. But it doesn't work. I often say this, that if your diet has a name, then it is bound to fail. फिर वो नाम keto हो, IF हो, कुछ भी हो, अगर diet का नाम है तो वो चलने नहीं वाला है. A diet has to be nameless, because only then, especially for our for a country like India, where really it's like my food is not even food for you, it's like we all eat so differently that we have to work at keeping the diverse cuisine of our culture alive. Because when people eat more according to their cultures, their cuisine, and their climate, then they can eat in that manner for a long time. Their compliance to that diet is better. Compliance of the diet is better means that the results out of following that diet is going to be better. If they start doing diets which are extreme, which are not compliant to their culture or cuisine, then they don't comply with the diet. And then instead of understanding that we put them on a poorly designed diet, we tend to feel that our clients or our patients are just poor on willpower. They don't have it in them to knock off weight. They don't have it in them to get better, and to have a pain-free period or to just have a regular period. People are dying to have these kind of things. They are literally putting themselves through extreme deprivation methods to comply to something unreasonable, but they don't have to. What science is saying is that simple home cooked food of local, seasonal, traditional can give you good health. Eat outside food lesser, eat home cooked food more, sleep on time, make time for exercise. It is so commonsensical that it cannot be monetized, which is also why it is so unpopular.
So what you're saying is something what my mother and grandmother would say. Eat local food, don't refrigerate. I mean, don't keep food too long, those kind of no-tinned food. Well, today it's much more of outside food. If it is so common sense, why, according to you, is it not being followed?
I will not say that it is not being followed, but
not as much
followed with the confidence that it should be. And the reasons for that are many. See, when you are a former colony and when you are a largely patriarchal society, then the advice of women, the advice of collective wisdom, the advice that comes in native languages, the advice that comes through the medium of oral heritage is all placed lower than advice that comes from men in English and in writing and with an attitude of, like being dismissive towards you. So, and I'm sure that, all of you doctors here also face it in your own careers. The struggles are immense for any working professional, especially if she's a woman. So the reason why we don't take commonsensical advice more, as well as we should, is because the wisdom bearers are women. They are your nannies and dadis, and they teach you food science through songs and proverbs and stories. And our concept of science is that it has to be dull and boring and bouncer. So that's where the problem is. But, slowly and surely, हर रात को उल्लू घर पे ही लौट आता है. So we try all extreme methods. Finally we say, now I have given up. अभी मैं और कुछ नहीं करने में, मैं सीधा साधा घर पे मैं खाने वाली हूँ, रोटी सब्जी दाल चावल, मैं योगा करने वाली हूँ. And then you feel like within 3 to 4 months magic starts happening, because it takes 3 months for the body to show any kind of a result or any kind of an adaptation to a sustained response. So I mean, to a sustained stimuli. So at least that stimuli has to be reasonable enough कि वो 3 महीना चले. And if we are really ambitious, then we need that stimuli to work for the next 30 years. Because see, we are talking about PCOD right now, but as women, it's like later on we will be perimenopausal, then we will be menopausal, then we will be postmenopausal. We can't be doing anything silly right now and then paying a price for it for the rest of our lives.
So that's very true, Rujuta, because with PCO, the concern is not just the woman herself, but the children also.
Yeah.
Because, now we do see transgenerational effects of this kind of disorders, metabolic syndromes. And therefore, it becomes very, very important and responsible for the woman on the dietary habits. And what you're saying is something pretty simple. Go for seasonal fruit. Don't go and have watermelon in December in cold. Go for something local. I mean, something which is makes sense because even you have the right gut flora to help assist in the digestion. And today, gut health is so very important.
Absolutely.
Now, we go to very specifics, what people really would like to know, things that a woman with PCOS should eat and should avoid, because people are finally looking at more specific. The generic has been understood, but
Correct.
more specifics.
Okay, so for all the people that I work with, so one of the things that we work at doing as a very baseline into their diet is that we work at building more diversity into their diets. Okay, so number one, diversity in terms of millets. So not just roti and rice. While roti and rice is important, I'm not even once suggesting ke roti khana band karo. Never. Please eat your roti. But along with that, at least once every week, you need to have some kind of a millet. So it can be ragi, it can be jowar, it can be bajra, or what works really well in PCO is also rajgira. So we need to have this millets back onto our plate for at least once every week. That's one thing. The second thing that we must do is build more diversity in terms of the sprouts and legumes that we are having, because PCOS will also mean breast which will hurt or breast which feel heavy. So typically B6 being low, or amino acids or protein intake being low. And one of the ways to address that, along with addressing good gut health, is to include more sprouts and legumes in your diet. Now, our sprout and legume intake has just come down to maybe arhar ki dal and moong ki dal, but there is so much that we have forgotten. So there is gehat, which we have forgotten, so there is kurit, there is lal chawri, there is lobia, there is chana, there is rajma, there is hara kind of chana. India had a diversity of pulses, I think about 65,000 varieties of pulses. Now we are barely left with a handful. So we encourage our clients to be eating at least 10 to 12 kinds of pulses throughout the year. The third thing that we get them to eat are more dry fruits and fruits. So I don't know if you're aware of this, but we ran a project sometime in the lockdown where we asked women to wake up, the ones who were having really troublesome periods, to overnight soaked black raisins, to kind of reduce the kind of PMS that they were experiencing. And that really worked well. So waking up and eating something, starting your day with dry fruits and nuts, again, a very commonsensical advice. We reinforce that to include a daily intake of dry fruits and nuts is important. And all kinds of nuts, including cashews, including peanuts, including walnuts, almonds, your figs, raisins, whatever you fancy, but have that on a daily basis. The fourth thing is vegetables like root vegetables, which we now don't have very often, but they work really well for your hormones. So the suran, the arbi, the kacha kele ka bhaji, banana flour ka bhaji, because banana flour ka bhaji will also give you, it's like very small levels, but some progesterone nevertheless. So it's like, these things, they help you build better hormones. These are foods which increase the diversity of nutrients that you are otherwise having access to. And the last thing that we ask everyone to have is a fresh fruit of the season. So whether it is the mango, the banana, sitafal, chiku, jamun, bear, mulberry, jo bhi season mein hai, eating that fruit. Otherwise, we are just eating the same apple or the same kiwi or the same whatever year round and expecting miracles to happen, where actually what works is having a diversity in your diet. So having all of these meals, and then 3 meal timings are very important. Number one, eating something within the first 10 to 15 minutes of waking up and then having your chai or coffee. So not starting your day with a tea or coffee. So that's the first thing. The second thing that works for PCO really beautifully is eating a wholesome meal between 4 and 6 p.m. in the evening, because this is also the time when your cortisol levels should settle down or drop down. And that is one time where we don't plan for what we are going to be eating, and then we are eating the samosas and the bhelpuris of the world, making statements like, I can be on any diet until 5 p.m. in the evening, par uske baad mein mere andar ka rakshas jaag jata hai. That's only because you've not planned for anything. And if you have nothing at all that you can eat, at least eating a banana will help you. Everyone aspires to have a small dinner, but the only way to have a small dinner is to eat something by 4 or 6 p.m., which is wholesome. So eating that 4 to 6 p.m. wholesome meal. And the third thing is to include ghee in your diet. So we encourage everyone to have at least a teaspoon of ghee in their breakfast, in their lunch, and in their dinner, so that they're able to access all of the nutrients much better. And then, of course, having your home cooked pickles or home cooked achars. But the three important things would be to eat something when you wake up and then having your tea or coffee, ensuring that you're having a 4 to 6 p.m. meal, not forgetting that, and that has to be wholesome. So you could do a poha, you could do a uttapa, you can do like a chivda, or you could simply do banana, and then including ghee in your diet. Again, like not like ghee like a superfood where you're starting with a ghee shot or having tons of it, but we all know what is the right proportion of ghee. Roti sabzi kha rahe ho to 1 teaspoon, kabhi jab puran puri khaoge tabhi 3-4 teaspoons, or maybe that's the, or dal bati also requires more ghee. So adjusting your ghee as per the season and as per what you're eating.
Have clarified on the types of food. Also comes with the quality comes, and the diversity comes the quantity. So any advice on how much, when should one stop? Because sometimes the feedback is not good enough, and one tends to overeat.
Correct. So see, I feel that, keeping meal timings is a good way to ensure that you're not overeating. So you eat something first thing in the morning, then you make sure that you have your breakfast before you leave for work. Then you make sure that you have your lunch by 1 p.m. You eat something by 4 or 6 p.m. and then you try and have your dinner by 8 or 8:30. Now, at any point of time, if you feel that I'm so full, if I'm so full post breakfast that I cannot have my 1 p.m. lunch, if I'm so full at 1 p.m. that, if I've eaten so much at 1 p.m. that I forgot to eat something between 4 and 6 p.m. in the evening, then those are good signs of knowing that I am overeating. But what I would like to say is that the weight loss industry has almost made all of us feel that we are overeating. I don't think that as women we overeat. A lot of times we in fact undereat. If you typically look at what women tend to do, they jo bhi bana hai, they tend to see that has everyone had enough, and then they kind of almost calibrate and adjust how much they're going to be eating. So I don't think that any one of us really overeats without knowing that we are overeating. Maybe sometimes you liked something, so you had an extra bite, at that time that you're overeating. Utna chalta hai life mein, because it is real life. But on a day-to-day basis, the only time that you actually overeat is when you're distracted. When you're distracted because you're doing an online meeting, video off karke khana kha rahe ho, ya TV dekhte hue khana kha rahe ho, व्हाट्सएप पे लोगों के फॉरवर्ड्स देखते पढ़ते पढ़ते खाना खा रहे हो, या फिर emails आंसर करते हुए खाना खा रहे हो. If you are distracted and you're eating, then you are invariably overeating. Otherwise, appetite is a moving entity. Every day you will be differently hungry, but your chances of overeating are lesser if you followed what your grandmother told you, which is if you ate with all of your senses. So you sit down at one place, you engage all of your senses, smell, sight, sound, touch, taste, and relish every bite. Because I really feel, Rajvi ma'am, the one thing that none of us will be able to do after we are dead is enjoy our food. We will never be able to eat after that. We can be as 0 calorie as we want to be. So while we are alive, we must ensure that we taste and relish and enjoy the food that's there on our plate. That's the whole point of being alive.
Okay, so live to eat and eat to live.
Absolutely. Yeah.
My last question, scientists are like lawyers, always suspicious, I would say, because they always need evidence for everything. And if there is no evidence, well, they question. You have been working, as I'm aware, for a long time with patients with PCOS. What has been your experience with the patients, with their symptoms, with their reversal of the symptoms or infertility? With whatever data, obviously you would not be doing it in that pure detailed scientific sense, but obviously you have your own ways of finding out how the patients do. So what has been your experience with that?
So we feel that, from the time that they actually start making these lifestyle changes within 9 months to 18 months, somewhere in that range, you do see a resolution. You do see that people need to take, for example, it starts with needing lesser painkillers for their periods. It starts with getting their period every month versus getting once every 3 to 4 months. It means getting pregnant as something that they were just planning for the longest time, but they'll get pregnant in the range of the next 9 to 18 months. Some will get pregnant a little faster, some a little lesser, but if they're planning for a family, then we do see proper pregnancies where the child is going all the way up to maturity, like good healthy pregnancies, quick return to good shape post delivery, all of that by making simple sustainable changes. And we always ask all of them to at least invest 2 days in Iyengar yoga and the restorative sequence that you have, which you have very kindly put out everywhere on social media also. So that is something that we ask them to do for a week before their period. Now, exactly how it works, the whole Iyengar yoga and stuff, I don't know exactly how that works, but what we see is that it always works. And by always works, again, it's like it doesn't work in an instant. It takes a long time, but if you build it in a sensible manner, then you want to be doing these things for the rest of your life, at least for the next 30 years, and not just for the next 2 or 3 weeks till you are on fire to change yourself to go from excel to excess in these 3 weeks. It's now or never. If you are on a bandwagon like this, then no. But the minute you are more sensible about it, more long term, then yes.
So thank you very much, Ujita. These
Thank
are the
you.
last. We can go on talking, but we have 2 other presentations to go.
Yes.
Thank
Yeah.
you very much. I would just like to add here that I was with her, being a scientist and a scientific skeptical mind as we are. I did go with her. I did ask her once that does it really work and what happens? And she did share some data with me. And I did go with those group of patients who were going to a farm.
Yeah.
Obviously, they didn't know I was not a part of them. So I was put on the WhatsApp group. And I admit that for at least the next few months, people were writing their happy stories about, periods becoming normal, etc. I didn't look at it very objectively, but it sort of gave some evidence. Maybe it's time we can actually collaborate to get hardcore. So
Yes.
we guide these millions of women who are suffering, and maybe we can have more concrete scientific kind of studies maybe in the future. So thank you so much, Rujuta, for your time.
You're welcome.
And
Pleasure's all mine.
and over to you now, Dr. Shalini.
Yeah.
Thank
Thank you so much, Rajita, for clearing so many doubts of ours and so many people who are watching you and they are live on YouTube. And I'm sure they certainly would be benefited by your talk and by your regime and your this thing. And I'm very sure that there would be a lot of questions for you, and we'll take them later. So I would just request you to stay for 10 minutes or so, so that if there are questions for you, then we'll take immediately after the next talk.
Well, there are
Yes.
tons of questions actually.
Yes.
So maybe I think a lot of them has been answered because she
Right.
did talk about, timing questions,
Yeah.
whether it can be reversed. Well, it depends.
Right.
Whether what dry fruit should be soaked and eaten. I
Uh,
guess if you would want to answer that part, Rujuta, if you're still there.
Uh,
One quick
you
question.
know, So almonds is what one typically soaks overnight. So soak your almond overnight, peel them, and then eat them. Same thing with figs and black raisins. Typically soak and then eat. Now, when it comes to food, what I often do is that I ask my clients, what is your mother? What does your mother do? What does your dadi or nani do? What is your bua saying? How does your masi eat this? And we get them to eat it accordingly. Because see, we all know that our gut flora is so distinct that in the future it could even be used as a, like the way they're using our fingerprint, because it is so unique to each one of us. And therefore it is how we assimilate nutrients is also unique to the combinations in which we eat them. So there is no standard way of eating any kind of food, whether it is almond or whether it is dal chawal. हर किसी का method अलग है. And if we are looking at our clients optimally assimilating all the nutrients that they get from their food, then we have no option but to get them to stick it out with their time-tested methods of cooking them and eating them.
Okay, thank you. Thank
Thank
you,
you.
Ruchita.
Thank you.
And because of the paucity of the time, we move on to the next session. And my real pleasure to invite Dr. Rajvi Mehta, who actually needs no introduction. Shivam, can you share ma'am's CV? Dr. Rajvi Mehta is a great academician and a scientist. Ma'am has done PhD in human IVF, and currently she is the consultant with Cooper Surgical India and with the Trivector Biomedicals. Ma'am is not only an academician and an embryologist. Ma'am does so much training in yoga, and I am sure that many of us who are in close association with her really appreciate that she does a lot of training in yoga and helping so many people. So, and as it is, PCOS is a stressful condition. We have heard the medical role, we have heard the myths and facts, we have heard Rujita. Now it's time to hear what yoga and how yoga can help in de-stressing. So over to Rajvi ma'am for your talk. Ma'am, you're muted.
Thank you, Dr. Shalini. So I will go to my talk on how de-stressing and the role of yoga. So to start with, let me just share my screen. Okay, is the screen visible? Wait.
Yes. Ma'am, you can, yeah.
Yeah, it's not in the, 1 minute, I'll just.
Yes. So ma'am has won many awards also. She was the recipient of first ISAR.
Okay, I think,
Young Scientist.
Thank you. So we're going to be talking about de-stressing and the role of yoga. So having said that, I'm going to start a little offbeat, and I'm going to start this presentation talking about Dr. Subhash Mukherjee. And those of us who are working in the field of IVF know Dr. Subhash Mukherjee, who has been responsible for the first IVF baby in India, the first frozen baby in the world, whose work was questioned, and he met an untimely death by suicide. His work came to light nearly 30 years after his death, and today we recognize the genius that he was. Along with that, why do I bring him? As a part of one of my projects where we are looking at the work done by Dr. Subhash Mukherjee in the field of IVF, we were going through his documents, and this is what he had written in the 1970s, a connection between stress, excess ovarian and adrenal deficiency, abnormalities, excess androgens, ovarian insensitivity to gonadotrophins, failure of follicular maturation and ovulation. Then he goes on to say stress, excess androgens, and he goes on to say specifically which ones: DHEA, testosterone, etc. So the fact is that in the 1970s, stress was never really understood to be a cause of disease. Today, it is, I think, in the last 10 to 20 years that people talk about stress as a physiological cause of a disease, but there was this genius who spoke about it way back in the 1970s. And that shows the depth. And he had gone on to actually postulate the entire endocrine physiological pathways. I'm not going to go because the topic is not to understand how stress affects and causes PCOS, but it shows that a genius scientist had seen a connection between what was considered as a psychological issue. Now, what exactly is stress? We call stress as a state of mental or emotional strain, which is a result from adverse or demanding circumstances. Now, emotional and mental strain is very common. It is not something that none of us feel strain. Everybody I had to give the talk, I'm going to feel strain. And it also depends on my perception of what is adverse and what is demanding. Now, consider a woman with PCOS with or without infertility, because a lot of adolescents, a lot of young women who have not even considered about starting a family do suffer from PCOS. So the physiological causes add on to the stress. Hirsutism, acne, a young teenager, a 20-year-old who is definitely conscious of their appearance, when they get severe hirsutism, they are conscious of it. Periods, irregular periods, the metabolic changes, obesity, weight gain. And in this stressful situation, because emotionally they feel psychologically quite drained, and then we are asking them to lose weight. So the question is that the endocrine and metabolic disruption that is there leads to weight gain, or is it weight gain which causes stress and leads to endocrine disruption? So as I said earlier, it's like a chicken and egg story, which came first. And because of this, they get entrapped in this cycle of endocrine metabolic disruption and weight gain. So stress is an integral part of a PCOS woman. Now, what are the symptoms of stress? So how does one experience or express stress? Because it is something which is very abstract and subjective. So one can say that when you feel stressful, your limbs of the body are quivering, the mouth gets dry, maybe trembling, internal trembling, hair stand up, burning, and there's an overwhelm with pity. My previous speaker, Dr. Shalini, said, why me? That's the kind. Eyes filled with tears and agitated, full of sorrow. These symptoms of stress are not something novel. If I were to talk about these symptoms in another language, in Sanskrit, all this has been said in the Bhagavad Gita, the epitome of yoga, in the first chapter, where it is Arjun talking about what he is experiencing to Lord Krishna. So stress is absolutely an integral part of a human being. But what has changed? So it has been there since millennia. What has changed is our ability, or I wouldn't say change, what is required is a change in our ability to perceive stress and handle stress. And therefore, if we talk of the Gita as the epitome of yoga, I'm going to be talking of how yoga can help in altering our perception of stress. So if I don't feel stress, if I don't perceive stress, then stress cannot have an effect on my body. So as Rujuta said, when you get into a state of moderation, her whole talk was on moderation, no extremities, whether it is in diet, whether it is in the amount you eat, whether it is in timing. It's all about moderation, and moderation is the crux of yoga. Samatvam yoga uchyate. Samatvam is equanimity in yoga, and that is the crux of yoga. Now, when we are talking of moderation, the question, so as I wear two hats, I wear the hat of a trained scientist and I wear the hat of a yoga practitioner. As a scientist, we are very objective, evidence-based. As a yoga practitioner, we are experience-based. And therefore, where do those two meet? So the question is, well, if yoga is going to help, if it has helped Arjun, is it going to help women? Is it going to help people who are stressed? So we look at evidence. So is the key to de-stress or not perceive stress as it is lie in yoga? So I'm just going to quote some studies which have been published not in yoga journals, because to me, any publication in a yoga journal has no meaning as far as scientific studies go, because, well, we do believe in it. So I don't need evidence as a yoga practitioner that it works. My experience tells me. But if you are scientific, if you are a clinician, you are going to ask a patient to practice, you need the evidence, because otherwise it's not ethical. So these some studies which have been done. So there were these women who had perceived emotional stress, a classical controlled study with waitlisted and the yoga group. And then they found that there was a significant decrease in perceived stress, trait anxiety, decreased depression and fatigue, and increased vigor and well-being by the practice of yoga. So one of the earliest studies in early 2000 which showed that yes, you perceive emotional stress later. Then when you look at another study reported nearly a decade ago, they studied the yoga group, 2 different groups over a period of 3 months, and you had a control group. As you can see in the control group, the baseline to 3 months, the perceived stress score remained unchanged. However, when you looked at the yoga group, there was a significant decrease in 3 months in perceived stress in both the groups of patients, and the significance level was very high, clearly indicating that distress can be converted to de-stress. Then when we looked at another study in young adults with anxiety and depression. So in this particular case, they looked over the back depression scale and the state trait anxiety score. Here you can see the control group, there was no change. But here you see a drastic change over a period of time in young adults. I've just put in a few studies to explain, to provide the evidence that there is a drop in the anxiety and depression. Very recently, we have completed a study with medical professionals, mainly medical doctors, who are in extremely stressful. COVID showed us what is the level of stress faced by the medical professionals. And on the completion after 3 months, we find that there is a tremendous significance decreased in the perceived stress scale in these doctors also. So evidence shows us, yes, there is a decrease in stress, anxiety, and depression with COVID stress. Even there is a change in mood. Now, these were individuals who had, so you can see their positive mood status change pre to post, and the negative status actually, which is feeling of sadness, frustration, depression, anxiety, anger, pessimism, have all decreased. So all these studies do provide evidence that yoga does help in the alteration in the emotional state. Now, what exactly is the practice of yoga? Yes, you may be convinced that yes, there is evidence, but what am I supposed to do? What is this practice? Now, I will just ask you, all of us have been sitting for the last 1 hour. Just observe how you sit. Now, if you were to observe, if your breathing is shallow, when you're anxious, there is a strong connection between the body, the mind, and the breath. So when the mind is anxious, awaiting something, the breathing becomes shallow. When the mind is depressed, again, the breathing is very shallow, short breaths. You see, so that's why when somebody is stressed out, you'll say, take a deep breath. When the mind is calm, the mind is focused, the breathing becomes soft. Now, how easy is it to modulate the breath? It is not so easy, because the more I try to breathe deeply, so if I ask a person, take a deep breath, they will take a deep breath, which creates a lot of tension. But if I ask that same person that imagine there's a flower in your hand and inhale the fragrance of a flower. Now that becomes a quiet, peaceful, deep breath. So that kind of an understanding is required so that the breath and the mind is connected. Now, how is the body and mind connected? So when a person is depressed, the chest is all collapsed, the shoulders droop, and one sits with tension like this, with the hand on the head, on the forehead, on the arms. But the moment the chest is lifted, immediately the emotions are lifted. So there is a close connection between the body, the mind, and the breath. And this kind of connection can be brought in the practice specifically of yogasanas. So when we mold the body into different positions, then it alters the breath and it alters the minds and emotions. So I'm now going to say, what are these asanas that can be done? And first, when there is stress, the stress is more in the head. So the head has to be lowered. We bring the head lower down, lower to the heart, the different asanas that can be done where the head is lower than the heart. When the head is lower, mind calms down, anxiety comes down. And that is, if you practice regularly, then the perception of stress is much lower. The onset of anxiety decreases. The inverted asanas play a big role in bringing down the stress levels, in bringing down anxiety. Now, somebody who has never practiced before will look at this and say, just looking at this or anticipation that I have to do this is going to increase my stress levels. The fact is that is why you require a good teacher. So you don't do this on the first day. Like Rujuta said, everything comes in gradually. So you are taught starting with these kind of asanas where you learn to get your head down, then you go to inverted. And mind you, today millions across the world can do this provided they are trained by a very qualified teacher. But this tip goes to those who are regular practitioners. Then we know the gut-brain connection. We in the yogic terminology call it the endocrine, abdominal, and emotional connection. So in this case, when you are in this kind of an inverted position or a back arching position, abdomen, if you notice in all the poses that are given, the abdomen becomes very, very soft. When the abdomen is soft, when the legs are firm. So if you look at all the three poses, the legs, when straightened, are absolutely firm, thigh muscles descending on the bone. And when the abdomen is soft, the chest gets lifted, and then the mind quietens down. Now, this can be trained and taught with the use of supports and props. But remember that this training takes time. So nothing happens overnight. The gut-brain connection, the abdomen-brain connection. Now, also remember that when I say abdomen soft, the effect on the emotions. We've heard the terminology in English language. We feel butterflies in the stomach when you're action. Why are we talking about the stomach? Why are we talking about that region? Why are we talking of the abdomen when we are stressed? So again, the body-breath connection. The supine asanas where one can be restful. Again, here you can see that the chest is propped up, where the chest is lifted. Emotions are lifted. So with the limited time, I have tried to give you the different asanas, but I don't anticipate that looking at this, you can learn the subject of yoga. You can immediately follow it. So the message is because every individual's body is different. I may be flexible, I may be stiff, I may be hyper flexible. So one has to understand one's own body. And depending on one's own body, one can start the practice. The capacity is different. So you have to identify. When we start, we cannot learn any asana overnight. To believe that the subject of yoga can be learned in a span of 2 weeks, 2 months, to teach, I think is ridiculous. Today, what is very, very amusing to me is people write to us saying they want to become yoga teachers. Are you a student of yoga? No. Then how can you consider teaching a subject which you haven't studied? Imagine becoming a maths teacher without studying math. So please be careful that the experience, you need somebody where you start your practice at the skeletal-muscular level, it gradually moves to the organic level, and it moves to the emotional level, and then you start experiencing the changes. You need to learn from a highly experienced teacher. When I say highly experienced, it is a teacher who also practices. When in the subject of yoga, continuous learning is an absolute must. You cannot stop learning and say, I have done a course, I am a teacher, and now I can teach. It is continuous learning because your body changes by the day, by the years, and you will be able to handle the student much better. And a teacher who can read your body and give you not just what to do, but how to do so that the requisite effect is got. So with this, I end by paying my respects to my Guru Yogacharya PCOS Iyengar, who started yoga at the tender age of 16, born during the world influenza pandemic 1918, who revived this subject of yoga in the world. And today it is yoga needs no introduction. So I pay my gratitude because it is through his teachings in person and through his work that whatever my experiences, I share with all of you. So thank you very much. And over to you, Dr. Shalini.
Yeah. Thank you so much, Rajvi ma'am. It was such an enlightening session. We all got this information and this knowledge that yoga definitely plays a very important role in de-stressing. So diet, de-stressing certainly plays a very important role. And as you laid so much emphasis, and it's true that learning from an experienced yoga teacher is very, very important. It goes like this, that little knowledge is a dangerous thing. We find so many people, they have just done 2 months or 3 months courses, and this start claiming themselves as yoga experts. So it is very, very important to go along, to learn smoothly and steadily, maybe slowly, but the right way. So thank you so much, Rajvi ma'am. And with this, we move on to the next session. And my pleasure to invite Dr. Ritu Jain. Shivam, can you project Dr. Ritu Jain CV? Yes. Dr. Ritu Jain is a great friend of mine. She is a director, Vardhman Medicare, IVF and ICSI Center at Gurgaon. Currently, she is the president of Gurgaon Obs and Gynae Society. She is the founder secretary of IFS Haryana chapter. She is also the IFS national coordinator. She has held so many positions. This list is endless. So just to brief, just to cut short, she is also the joint web editor of IFS and joint clinical secretary of Haryana Obs and Gynae Society. And she has delivered many talks and presentations. And I request Dr. Ritu to take over and give her presentation.
Thank you, Dr. Shalini, for this nice introduction. So I am just starting sharing my screen. So I hope my screen is visible and I am audible to everyone.
Yes.
So it is on a slideshow? No?
No.
Right, I'll just do it. Why it is not on the slideshow? Can I continue like this, or I put it on the slideshow first?
You can continue.
I can continue?
Yes.
Yeah. Good evening, friends. First of all, I thank my previous speakers, Dr. Shalini, Rujuta, and Dr. Rajvi, for enlightening everyone on PCOS. My job has been much lightened, and it is sort of a take-home message from my slide. Now, we all know PCOS affects almost 10 to 20% of the population, and it is an epidemic, whether we accept it or not, and it is the major silent killer, and it is the basis of all lifestyle diseases, and we have to prevent it at all the cost. So it is a lifestyle disease which affects life in every possible way and at different platforms, and definitely the treatment is lifestyle modification. So let us not delay, undo the self-harm, and reverse the clock. The definition has been already stated, and depending upon which feature is predominant, whether it is the increased androgens or menstrual irregularity or PCO morphology on the ultrasound, all different combinations are there in both in obese and lean PCOS. So we all come across these kind of patients. So to understand the treatment, it is very important to understand the origins, and we know it is from genetics, lifestyle and environment changes, the neuroendocrine and the obesity. It is very important to understand the relation between the genes and environment. It is not only genetic, but it is modified by the environment, and then it goes transgenerational. So it is very, very important for anyone who has got it through the lifestyle factors to modify it so that it doesn't go down the generations. Why we are so much focusing on PCOS in this webinar is because we know that it can affect each system. It can cause glucose intolerance, diabetes, dyslipidemia, hypertension, then heart disease, and in females, 10% of the patients, it can cause endocrine cancer. So it is cancer of the endometrium. So it is very, very important to control it in its incipient stage. So lifestyle change is the challenge, and it is the initial 6 months which are more important, because once a woman or a girl starts losing weight and maintaining her self-esteem, then she gains confidence, and then continuation of the effort goes on. So it is very, very important to emphasize the persistence in initial 6 months. So one has to at least, first of all, demotivate from this junk food or this word of endocrine disruptors, which we know are increasing day by day, because this contains xenoestrogens, which lead to increased testosterone, and it affects the regulatory genes, definitely leads to obesity and disrupts the metabolic activity. And it affects the reproductive neurological system, developmental system, and immune effects. And it is there in the young population like anything. It sort of, the thing is, it has become their first diet, and home-based diet has become their second diet. So as Ruchuta also said, that we have to control PCOS in a physiological, natural way. The same way our nani and dadi used to cook, eat, and the things used to be planned in time. So first of all, 5 to 10% of weight loss, that is a gradual weight loss. It will restore normal cycles in 30% and ovulation in 10%. So it's sort of a self-cure. And the diet has to be hypocaloric, 1200 kilocalories when we want to lose weight. And it should be high fiber, high protein, and low carb. 150 minutes of moderate intensity physical activity or 70 minutes of strenuous physical activity and muscle training. This is in nutshell. Now, low calorie diet comprising of high protein, complex carbohydrate, and moderate fat. The calories have to be reduced to 1800 to 2000 if we have to maintain the weight, and less than and 1200 if we have to reduce the weight. What we term it as a medical nutrition therapy, that the diet should be like whole grain breads, choose oat-based cereals like porridge or muesli in the place of white breads, add millets and eat multigrain atta, combine carb always with protein or fat. Low GI grains should be included in meals like barley, quinoa, and buckwheat. Try to fill the plate at lunch or dinner with a variety of vegetable and salads. At least 1200 kilocalories should be taken to maintain your day-to-day life. Avoid ketosis. Don't stay hungry. That is very, very important. So sort of diet has to be yogic and sattvic. The butter, you can replace butter on bread with avocado, tahini, or pure nut spreads. Use olive or canola oil in cooking, and olive oil, flaxseed. Drink at least 8 cups of non-caffeinated fluid. You drink, one has to avoid all saturated and trans fats like whole milk, dairy butter, chicken skin, fried foods, rich desserts, and mainly select the mono unsaturated fats like olive oil, nuts, omega fatty acids, and these fats are really healthy for the heart. And replace salt in cooking with fresh and dried herbs and spices. It is very important to have 4 to 5 meals or snacks. Never skip your breakfast, never skip the meals, take meals in time. Every time food should be a mixed plate, which should contain fruits, vegetables, grains, proteins, and there should be protein in most of the meals and snacks. The beverages should be healthy, such as water, low-fat milk. One can have fortified soya beverage as well. Avoid carbohydrates which trigger more hunger or cravings, and snack on fresh fruit, raw nuts, yogurt, and whole grain crackers instead of fried namkeens and bhujiyas, pakoras. So the old time food has been very, very scientific. The traditional Indian diet is itself was in home remedy because it was anti-inflammatory diet. The diet which is still consumed in villages consists of whole grains, lentils, methi seeds, flaxseed, honey, amla, cinnamon. They are really, fat burners, and high fiber vegetables, carrot, cucumber, broccoli, and salads. They really help in burning the calories. So the foods which should be eaten should be unprocessed food in more natural way. Dark red fruits such as red grapes, blueberries, blackberries, cherries, they are anti-inflammatory. Broccoli, cauliflower, they add to fiber, and definitely turmeric and cinnamon, they are very good as an anti-inflammatory and healing factor, and they try to sort of decrease so many factors which help in fighting weight. So we know that PCOS is a combination. It is driven by high carb intake, low inflammation, insulin resistant, and elevated androgens. So there are different kind of diets which are prevalent. One is DASH diet, which is primarily for reducing hypertension. Some people go for keto diet, which removes all the dietary carbohydrates, which can be significantly harmful sometimes. Let me take you through the pros and cons of the keto diet. It definitely improves the insulin resistance, sex hormone imbalances, good for metabolic health, and improves body composition. But it is not tailored for PCOS. It is hard on gut health. It affects the gut microflora. It cannot be taken for long. It can sometimes make PCOS worse. It is nutritionally imbalanced. It causes gut dysbiosis. Some sort of carbohydrate is always needed, as 20 to 30% of energy has to come from carbohydrate. It definitely increases HDL, but it increases the LDL also. It can increase the cardiovascular risk. And the junk keto diet, which includes vegetable oils, processed meat, and artificial sweets, it cannot be accepted for PCOS. And it does not correct the menstrual dysfunction. And overly restricting carbohydrate, it can definitely affect the thyroid function also. More importantly, this cannot be taken for long. So any diet which cannot be taken for long will not be the one which is the preferred one and chosen one. We need something which is sustained. So in short, if you have to look slim, you quit sweets. And if to have become fat, eat too much of fat. So please, very important to say no to sweetened beverages, high sugar foods, sweeteners, sweetened sauces, high fat foods, refined grains, trans fats, and refined oils. So very beautifully role of yoga has been highlighted by Dr. Rajvi, and she has in detail told the scientific connection and the evidence. We know pranayams, Kapalbharti, Anulom Vilom, Ujjayi, Shavasana 2 to 3 times a day. And madam has highlighted very beautifully the yogas which should be done. And these are other poses: cobra, lotus, bridge pose, leg up wall pose, cobbler pose. And power yoga is definitely got the power to, improve the insulin resistance in the muscles, and it definitely improves the insulin resistance and corrects PCOS. So these are different postures which definitely helps in improving the insulin resistance, and it corrects the underlying menstrual dysfunction. So nothing goes without exercise. It reduces the central fat, improves the insulin sensitivity, decreases insulin level, and decreases LH level. So the American Diabetes Association has recommended at least 150 minutes of moderate to high intensity exercise, with 90 minutes of these exercise being aerobic activity at moderate to high intensity. The exercise should be equally distributed over 5 days, with no more than 2 days without activity. One has to reduce the sedentary activity like watching television, playing computer games as much as possible. So how much to walk? Walk, brisk walk, and then run. It should be a gradual process. The peripheral muscles can metabolize 80% of the glucose. 30 minutes of brisk walk 3 to 7 times per week over 6 months is definitely reverses insulin resistance. And every time 30 minutes walking will burn 100 to 200 kilocalories. So as even the World Association has recommended that it is the diet and the exercise and consistency and perseverance in this which has main role in treating the PCOS. The medical treatment is after that. So for menstrual irregularity, it is the cyclical pills. If the cycle is more than 90 days interval, hirsutism, we give pills with cyprotron acetate, and hyperinsulinemia is the insulin sensitizers. For infertility, it is ovulogens and gonadotrophins. For morbid obesity, anti-obesity drug. So a word about metformin. We all know in patients who have glucose intolerance or increased or hyperinsulinemia, metformin helps by decreasing LH, insulin level, decreasing testosterone. It changes the microenvironment of the follicles, improves steroidogenesis, and it decreases IGF-1 and progression of PCOS, and it prevents OHSS also, ovarian hyperstimulation, when we are preparing the patient for IVF in case when it is needed. So a role of D-chiroinositol and myoinositol, it is present in ovary in the ratio of 40:1, and it definitely helps in improving the insulin sensitivity and ovulation. So this combination is a type of vitamin B which is present in our diet also in our body. It has to be there in the appropriate proportion for PCOS to regress. So there are certain guidelines about use of pills. We do not use pills right and left. Between 12 to 16 years of age, we prefer to avoid pills. If it is to be used for regularization of cycle, we use only for 7 days. Otherwise, depending upon if the menstrual irregularity is too much, low dose COC is preferred, but not for a longer term. So what sustains in long term is the diet and exercise. So natural forces within us are the true healers of the disease, as Hippocrates said. So the persistence has to be like this. If they say you can't, we should say we can. If they say you won't, it should be we will. So one has to be fighter for PCOS, and PCOS, one can plan for a healthy life through a change through diet, yoga, exercise, relaxation, and most important is being non-sedentary. So self-control is the key. Perseverance will give the result, and it has to be continued throughout life. Thank you very much.
Thank you, Dr. Ritu, for such an enlightening session. You have covered A to Z of PCOS, be it yoga, be it exercise, be it diet, and be it the medical nutrition therapy. So we'll take up the questions, and thank you so much, Dr. Ritu. And now my pleasure to invite Dr. Papa Dasri. Shivam, just share the CV of Dr. Papa Dasri.
It's all right. No need of CV.
Okay.
And
I would just say Dr. Papa Dasari is the senior professor, ART coordinator at JIPMER, and she established the ART services in government setup in 2017. She delivered first ICSI baby of JIPMER, and she established the SDU in 2018 JIPMER. She has done so much and so much work for JIPMER. And I would now request Dr. Papa Dasari to conclude and give the take-home message.
Yeah. First of all, I'm very thankful to IFS President and the Secretary to have included me in this SIG as a mentor, but I have not done much, not done anything at all. The credit goes to Dr. Rajiv Mehta, ma'am. She is the key person behind this arranging this meeting, and I thank her and I congratulate her for her hard work. All the four speakers have enlightened regarding the holistic approach with little bit of pharmacotherapy as well. Coming to Dr. Ritu ma'am, which has covered all aspects so nicely, I would say the holistic approach. The family is the most important one in lifestyle modification. I think it is very, very difficult to change lifestyle of an adolescent as well as adult woman. So the family plays a role. For adolescents, the teachers play a great role in the schools and colleges, where now, as it was told, the fast diet has become, it is becoming a norm, like just order and eat. They don't take homemade food. Even my children, I have boys, but he orders 3 times a meal through this Swiggy. So it is the family, especially the mother and grandmothers. It has already been told they play an important role. And Dr. Shalini ma'am has covered very nicely all the myths of PCOS. And she also told little bit on genetic and epigenetic mechanisms. The genetic and epigenetic mechanisms, even though they are the cause for 70 to 80%, environment plays a great role, I would say, because here the participants are also non-doctors. So already predisposition to PCOS is there if the mother, grandmother or PCOS, or there is a family history of diabetes, hypertension, hypothyroidism. So these are the people who are at high risk. So the diet modification and lifestyle, especially the way we live, should start from birth. I would say from birth. What kind of nutrition the mother is taking, because it is already been said that PCOS starts in utero. And then what the mother, lactating mother's nutrition we need to correct. And lifestyle, the family, if the family is practicing yoga in the morning, they're eating sattvic food right from 6 months or 1 year of age, the child follows very easily. I would say, example, my own child, when he was 1 year of age, coming 1.5 years, he will say, I will make chapati. He goes, I want to wash this. We don't allow them at all to do the active work. But if right from the childhood, we allow them to do small work at the home and then teach them dance, I would say exercise, introducing exercise, yoga, later in life may become very difficult. And I would like to introduce here our Indian culture, especially for girls, classical dance. I like it so much, though it is so difficult. But if we inculcate, say, for 1 year or 2-year-old child, small steps, and then make it a habit. Even yoga, at what time we should do? Is it early morning, or is it empty stomach, or late? So many yoga is there. Dr. Rajiv ma'am has elaborated so nicely. But for PCOS nowadays, even these medical reps are giving some pamphlets with this Dhanurasana, Bhujangasana, like that. So if we ask them to do yoga for half an hour or 1 hour, it is going to be difficult. We should teach them 2 or 3 effective yoga, which they can do it in 15-20 minutes. What is your advice, ma'am? Which are the best yoga for PCOS, which they can do just before getting up from bed? They say they can do yoga, 1 or 2 yoga.
Well, I think we always say we don't have time, but once we get into the mode, we find
Yes.
time. So people, there are a series. So we build up. So yes, a practice can be built up at least 2-3 times a week where they can practice for half an hour. So
Because they don't want to
yeah.
spend time. There are some people who are advising, okay, let them do 10-15 minutes before they get up from bed.
Yeah.
Just before get up from the bed.
Yeah.
What is your advice?
I'll say at least start with something. Just do something. Get up instead of just keeping it in the mind that we'll do something.
Mhm.
Get off the bed and start. Then obviously you'll go deeper. So you need to take the first step to start.
Yes.
So
Yes, one word regarding the nutrition, very nicely elaborated by 2 speakers, Dr. Ritu. And we should say all of them said, especially the keto diets, and what foods to eat, what not to eat. So very nicely elaborated, how much to eat,
I think we have lost her.
Yeah, I think the connection is poor. So I guess Dr. Rajvi ma'am, should we wind it up?
Yeah, I
Yeah.
think she's.
So we come to the end of this session, and I sincerely thanks the IFS team, President Dr. KD sir and Dr. Surveen. Dr. Papa
is back. Yeah.
Yeah. Dr. Papa, we lost your connection. You can go ahead. You're muted.
You're muted.
Dr. Papa, you're muted. Please unmute yourself.
What is
No, again, you're muted. We can't hear you.
okay? So fried foods and also refined processed foods, and they should also avoid coffee and raw meat. And most of these adolescents nowadays also have this habit of this alcoholism, which all these aggravate this condition of PCOS. As it is already been said, it is an epidemic. So it is not just the individual, the whole family has to change. That is what is the thing, because the non-doctors are there. Unless the family change the lifestyle, it is very difficult for us to change the lifestyle of the adolescent or even an adult woman who is waiting to conceive. And that's what I would say. There is a growth role for the family and as well as for the teachers, where it should start from childhood to prevent the effects of environment acting on these epigenetic mechanisms, so that the complications and the long-term effects of PCOS can be prevented easily. Thank you. Thank you for involving me.
Yeah. Thank you so much, Dr. Papa Desari, for for giving a complete picture and for summarizing it so well. And with this, we conclude this session, this webinar. And I sincerely thanks Dr. K.D. Nair and Dr. Surveen for giving us this platform to organize this webinar. And my sincere thanks to Dr. Rajvi Mehta, who has taken all the efforts to conduct this webinar. And I'm really sure many people would have gone with so many take-home messages. So special thanks to Dr. Rajvi Mehta. And thanks to Dr. Ritu, Rujita. I guess Rujita has left.
Yeah.
And especially our back-end team. Shivam is there. Sumit, for providing this academic this platform and the Zoom platform for conducting this session so well. So just concluding remarks from Dr. Rajvi, and then we just...
I just like to conclude that this online symposium would not have been possible if it was not the push from Dr. Shalini and Dr. Ritu. We have been considering for a long time, but it is thanks to them that it has become a reality. So my co-conveners, thank you very much. And my mentor, Dr. Papa, and of course, the entire platform of IFS led by Dr. K.D. Nair and Dr. Surveen. So thank you so much, everybody. And the event management team, Shivam, Sumit, thank you all. And of course, the audience, because no talk is stimulated in the absence of the audience. So thank you so much. And please feel free, you have our contact if there are any questions or any topics, because our SIG is aimed to be interactive with the patients, with the public. So if you have any suggestions, topics, let there be a good blend with this SIG with all of you. So you can get back to us. And thank you so much. Thanks once again,
Thanks.
Dr. Shalini, Dr.
Thanks,
Thank
Dr.
you, Dr.
Rajvi. And
Rajvi.
we would we will organize one more with Dr. Rajvi. Dr. Rajvi, we can look forward to make one for infertility in future, right?
Okay, sure. We can do that. Yes.
Yeah. De-stressing for infertility, we will do one more if time permits.
Yeah,
Thank you so much. Thank you so much, Dr. Rajvi.
Thank you.
Shalini and
Thank you.
everyone.
Dr. Rajvi.
I learned a lot, Rajiv ma'am, the connection, abdomen, hormones, and emotions. It is so good.
Thank you.
Thank you.
ma'am.
Thanks a lot.
Thank you.
Take permission to leave.
Bye-bye. Okay, bye-bye.
Bye.
Thanks, everybody.
Good night, everyone.